Vraylar, also known by its generic name cariprazine, is a medication that belongs to a class of drugs called atypical antipsychotics. It was initially approved by the U.S. Food and Drug Administration, FDA, in 2015 for the treatment of schizophrenia and bipolar disorder. However, more recently, Vraylar has shown promising results in managing major depressive episodes as well. The exact mechanism of action of Vraylar is not fully understood, but it is believed to work by modulating the activity of certain neurotransmitters in the brain. Specifically, Vraylar acts as a partial agonist at the dopamine D2 and D3 receptors, as well as the serotonin 5-HT1A receptors. By targeting these receptors, Vraylar helps to restore the balance of neurotransmitters in the brain, which can alleviate symptoms of bipolar disorder and major depressive episodes. Unlike some other medications used to treat these conditions, Vraylar has been designed to have minimal impact on other neurotransmitter systems, which may reduce the risk of certain side effects commonly associated with antipsychotic medications. Additionally, Vraylar has a long half-life, meaning that it remains effective in the body for an extended period of time, allowing for once-daily dosing. While Vraylar's precise mechanism of action is still being investigated, its ability to modulate the activity of key neurotransmitters provides hope for individuals struggling with bipolar disorder and major depressive episodes. In the following sections, we will explore the specific benefits and considerations of Vraylar in managing each of these conditions. Vraylar for bipolar disorder, efficacy and considerations. Bipolar disorder is a complex mental health condition characterized by extreme mood swings, ranging from manic episodes to depressive episodes. The treatment of bipolar disorder often involves mood stabilizers and antipsychotic medications to manage these mood swings and prevent relapses. Vraylar has emerged as a valuable treatment option for individuals with bipolar disorder. Clinical studies have shown that Vraylar can effectively reduce the frequency and severity of manic episodes, while also providing relief from depressive symptoms. Its unique mechanism of action, targeting both dopamine and serotonin receptors, allows for a comprehensive approach to managing the different phases of bipolar disorder. One key advantage of Vraylar over other medications used in bipolar disorder is its lower risk of causing weight gain and metabolic side effects. Weight gain can be a significant concern for individuals with bipolar disorder, as it can further contribute to feelings of low self-esteem and exacerbate depressive symptoms. Vraylar's minimal impact on weight is a welcome attribute for those seeking effective treatment without the added burden of potential weight gain. It is important to note that Vraylar may not be appropriate for everyone with bipolar disorder. As with any medication, individual responses can vary, and it is essential to work closely with a healthcare professional to determine the best course of treatment. Factors such as medical history, current medications, and potential drug interactions should be carefully considered before starting Vraylar. Additionally, regular monitoring and open communication with healthcare providers are crucial for ensuring the optimal management of bipolar disorder with Vraylar. Vraylar for major depressive episodes, effectiveness and considerations. In addition to its efficacy in bipolar disorder, Vraylar has shown promise in the treatment of major depressive episodes. Major depressive disorder is a prevalent mental health condition characterized by persistent feelings of sadness, loss of interest, and a range of physical and cognitive symptoms. Traditional antidepressant medications, such as selective serotonin reuptake inhibitors, SSRIs, have long been the go-to treatment for major depressive episodes. However, a significant number of individuals do not respond adequately to these medications or experience intolerable side effects. This has led to the exploration of alternative treatment options, including Vraylar. Clinical trials evaluating the effectiveness of Vraylar in major depressive episodes have shown encouraging results. In these studies, Vraylar demonstrated superior efficacy compared to placebo in reducing depressive symptoms and improving overall functioning. By targeting both dopamine and serotonin receptors, Vraylar offers a unique approach to managing the complex neurochemical imbalances associated with major depressive episodes. Another advantage of Vraylar in the treatment of major depressive episodes is its potential to address certain symptoms that are not adequately targeted by traditional antidepressants. For example, Vraylar may help alleviate feelings of anhedonia, which is the inability to experience pleasure or enjoyment. By modulating dopamine activity, Vraylar can enhance motivation and restore a sense of pleasure in individuals struggling with major depressive episodes. As with any medication, there are considerations to keep in mind when using Vraylar for major depressive episodes. It is essential to work closely with a healthcare professional to determine the appropriate dosage and monitor for any potential side effects. Additionally, Vraylar should not be used as a standalone treatment for major depressive episodes, but rather as part of a comprehensive treatment plan that may include therapy, lifestyle modifications, and other medications if necessary. The role of Vraylar in managing mood swings. Mood swings are a hallmark feature of bipolar disorder and can significantly impact a person's quality of life. Vraylar's unique mechanism of action allows it to effectively target the neurochemical imbalances that contribute to these mood swings, providing individuals with greater stability and control over their emotions. By acting as a partial agonist at dopamine receptors, Vraylar can help regulate the excessive dopamine activity associated with manic episodes. This can help reduce the intensity and frequency of manic symptoms, such as elevated mood, increased energy, and impulsivity. At the same time, Vraylar's action on serotonin receptors allows it to address the depressive symptoms of bipolar disorder. By increasing serotonin activity, Vraylar can help alleviate feelings of sadness, hopelessness, and fatigue commonly experienced during depressive episodes. The ability of Vraylar to target both the manic and depressive phases of bipolar disorder sets it apart from many other medications used in the treatment of this condition. By providing comprehensive symptom relief, Vraylar can improve overall mood stability and enhance the quality of life for individuals living with bipolar disorder. It is important to note that while Vraylar can be effective in managing mood swings, it is not a cure for bipolar disorder. Ongoing treatment, regular monitoring, and open communication with healthcare providers are essential for long-term management and preventing relapses. Potential side effects and risks of Vraylar. Like any medication, Vraylar carries the risk of potential side effects. However, it is important to note that not everyone will experience these side effects, and many individuals tolerate Vraylar well. Common side effects of Vraylar include nausea, constipation, restlessness, and abnormal movements. These side effects are generally mild and tend to subside over time as the body adjusts to the medication. However, if these side effects persist or become bothersome, it is important to discuss them with a healthcare professional. In rare cases, Vraylar may cause more serious side effects, such as changes in heart rhythm, neuroleptic malignant syndrome, a potentially life-threatening condition, or increased risk of suicidal thoughts or behaviors. It is crucial to seek immediate medical attention if any concerning symptoms arise while taking Vraylar. It is worth noting that Vraylar may have different side effect profiles compared to other medications commonly prescribed for bipolar disorder and major depressive episodes. This underlines the importance of individualized treatment and close monitoring to ensure the optimal balance between symptom relief and minimizing side effects. Before starting Vraylar, it is essential to discuss any pre-existing medical conditions, current medications, and potential drug interactions with a healthcare professional. This will help to determine if Vraylar is a suitable treatment option and ensure that any potential risks are carefully considered. Factors to consider before starting Vraylar treatment. Before initiating Vraylar treatment, several factors should be considered to ensure its appropriateness and optimize the treatment outcome. These factors include medical history. A thorough review of an individual's medical history is essential to identify any pre-existing conditions or risk factors that may impact the safety and efficacy of Vraylar. It is crucial to disclose any relevant information to the healthcare professional, including past or current medical conditions, allergies, and previous medication experiences. Current medications. Vraylar can interact with certain medications, which may increase the risk of side effects or reduce the effectiveness of either medication. It is important to provide a comprehensive list of all current medications, including over-the-counter drugs and supplements, to the healthcare professional to ensure safe and appropriate treatment with Vraylar. Drug interactions. In addition to interactions with specific medications, Vraylar may interact with certain substances, such as alcohol or illicit drugs. These interactions can have serious consequences and should be discussed openly and honestly with a healthcare professional before starting Vraylar. Pregnancy and breastfeeding. The safety of Vraylar during pregnancy and breastfeeding has not been fully established. It is important to discuss the potential risks and benefits with a healthcare professional if pregnancy or breastfeeding is a consideration. Individual preferences and goals. Treatment decisions should always take into account the individual's preferences, goals, and expectations. Open communication with healthcare professionals is crucial to ensure that treatment plans align with the individual's needs and values. By carefully considering these factors, healthcare professionals can collaborate with individuals to determine if Vraylar is the right choice for managing bipolar disorder or major depressive episodes. Vraylar dosage and administration guidelines. The appropriate dosage of Vraylar will vary depending on the individual's specific condition, response to treatment, and any potential drug interactions. It is essential to follow the dosage and administration guidelines provided by the prescribing healthcare professional. For the treatment of bipolar disorder, the recommended starting dose of Vraylar is typically 1.5 mg per day, with a maximum recommended dose of 6 mg per day. The dose may be adjusted based on the individual's response and tolerability. When used for major depressive episodes, the recommended starting dose of Vraylar is also 1.5 mg per day, with a maximum recommended dose of 3 mg per day. Again, the dose may be adjusted based on the individual's response and tolerability. Vraylar should be taken once daily with or without food. It is important to take the medication at the same time each day to maintain consistent blood levels and optimize its effectiveness. It is crucial to follow the prescribed dosage and not make any adjustments without consulting a healthcare professional. Abruptly stopping or changing the dose of Vraylar can lead to worsening symptoms or other complications. Regular follow-up appointments and ongoing communication with healthcare providers are essential to monitor treatment progress and make any necessary adjustments. Combining Vraylar with other treatments for bipolar disorder and depression. In some cases, Vraylar may be used in combination with other medications or treatment modalities to effectively manage bipolar disorder or major depressive episodes. This multimodal approach can provide comprehensive symptom relief and improve overall treatment outcomes. For individuals with bipolar disorder, Vraylar may be prescribed alongside mood stabilizers to enhance mood stability and prevent relapses. Mood stabilizers, such as lithium or valproate, work by regulating the activity of neurotransmitters in the brain and can complement Vraylar's effects. In the treatment of major depressive episodes, Vraylar may be combined with traditional antidepressant medications, such as SSRIs or serotonin norepinephrine reuptake inhibitors, SNRIs. This combination can address different aspects of the neurochemical imbalances associated with depression and enhance overall symptom relief. Complementary therapeutic interventions, such as psychotherapy or cognitive behavioral therapy, can also be beneficial when used in conjunction with Vraylar. These therapies can help individuals develop coping strategies, improve resilience, and address underlying psychological factors contributing to bipolar disorder or major depressive episodes. It is important to work closely with healthcare professionals to develop a comprehensive treatment plan that integrates the benefits of Vraylar with other appropriate interventions. Regular monitoring and open communication will ensure that the treatment remains optimized and tailored to the individual's specific needs. Patient experiences and success stories with Vraylar. Real-life experiences and success stories can provide valuable insights into the potential benefits and challenges of using Vraylar for bipolar disorder or major depressive episodes. While individual experiences can vary, many individuals have reported positive outcomes with Vraylar treatment. For some individuals with bipolar disorder, Vraylar has helped to significantly reduce the frequency and severity of manic episodes, leading to greater stability and improved overall functioning. The ability to regain control over their moods and emotions has allowed these individuals to pursue their personal goals and experience an improved quality of life. Similarly, individuals with major depressive episodes have shared their positive experiences with Vraylar. Many have reported a reduction in depressive symptoms, such as sadness, loss of interest, and fatigue, allowing them to regain a sense of pleasure and engage more fully in their daily lives. It is important to remember that medication experiences can vary, and what works well for one person may not work as effectively for another. Additionally, individual responses to Vraylar can change over time, and ongoing monitoring and adjustments may be necessary. If considering Vraylar as a treatment option, it can be helpful to seek out personal stories and experiences from others who have used Vraylar. Online forums, support groups, or conversations with healthcare professionals can provide valuable insights and help inform treatment decisions. Conclusion: is Vraylar the right choice for you? Vraylar has emerged as a valuable treatment option for individuals struggling with bipolar disorder and major depressive episodes. Its unique mechanism of action, targeting both dopamine and serotonin receptors, allows for a comprehensive approach to managing the complex neurochemical imbalances associated with these conditions. By effectively reducing manic symptoms, alleviating depressive symptoms, and improving overall mood stability, Vraylar has the potential to transform the lives of those affected by bipolar disorder or major depressive episodes. Its minimal impact on weight and metabolic side effects further adds to its appeal as a treatment option. However, it is essential to remember that Vraylar may not be suitable for everyone, and individual responses can vary. It is crucial to work closely with a healthcare professional to determine the appropriateness of Vraylar based on factors such as medical history, current medications, and potential drug interactions. Vraylar should be viewed as part of a comprehensive treatment plan that may include other medications, therapy, lifestyle modifications, and ongoing monitoring. Regular communication with healthcare professionals and open discussions about treatment goals and preferences are crucial for optimizing treatment outcomes and improving quality of life. Thanks for watching.